Good day, everyone. It's Myrdith Leon-McCormack for World Bride Magazine, and we are going to talk about health and wellness. Some of the crazy things that are happening, that's been happening in 2024, 2025, and carrying over to 2026. We have the honor and the privilege of having Dr. Brett Bolton, who's going to get us together. Hi, Dr. Bolton. How are you?
Hi, thank you so much for having me. I'm doing great. Pleasure to be here.
Yay, thank you.
Mhm.
So tell me, where is your practice? Where are you based?
So I am in Fort Lauderdale, Florida, where it's
Okay,
absolutely beautiful out
the
today.
Sunshine State.
It's gorgeous. Yeah, beautiful day.
Good. So
Yeah.
now I don't know if you've noticed, but there has been an increase in
Yeah.
people leaving the country to get their teeth done, to get their hair done, to
Yes.
get plastic surgery. We've
Yeah.
heard the horrors of getting Botox and going to different places and different things, and it turned into a scare, and then it's kind of dwindled down.
Yeah.
But now there seems to be another surge,
Yeah.
and people are going to different places. Now, what I have noticed in my trip to Istanbul, the minute I tell
Okay.
somebody I'm going to
Okay.
Istanbul, they turn around, they're like, "Oh, are you going to go get some work done?" I'm like, "What kind of work are you talking about?" It's medical. Tell me your
Yeah.
opinion about this.
Okay, so it's real. It's happening now. It's happening from my practice standpoint. I hear about it almost on a daily basis. So I'm a hair transplant surgeon. I've been doing this now for almost 30 years. And we're hearing about patients going to Turkey regularly. And what's fascinating about it is they're going there because they're watching it on social media and they're seeing the best case scenario. And they're saying, wow, this guy got this great result. So I'm going to fly to Turkey and I'm going to get this great result.
Mhm.
And maybe they can get their great result, but a lot of times they're not. And so one of the stories I've been telling a lot recently is I had a week where all of my patients were from Turkey and they all happened to
Wow.
be corrective surgery cases, whether the
No.
hairs were growing out in funny angles or whether they had issues with the donor tissue as far as how they harvested the donor, unnatural growth of the grafts, unnatural hairlines. So it's very common that I'm seeing a lot of unfortunate cases. But I'm not saying that's always the case because I have
Right,
seen some good cases as well. So I
right.
don't want to say it's that you can't do it, but it's not as easy as one might think to get that great result.
And that's the interesting part because the body reacts differently
Yeah.
to different things. And one of the reasons after having such an extensive surgery, you have to go for a follow-up. So now the money you think you saved here and going abroad, you
Yeah.
have to keep going back to catching that flight to go, check on the doctor so he
Yeah.
can check on the work that he just did on you. So
Yes.
doesn't that sort of kind of defeat the purpose? Not knocking anybody out down from
Yes.
Turkey.
Right. Well, I agree with everything that you're saying. There for any time you're shopping for any type of cosmetic procedure,
Mhm.
the last thing you want to be doing is shopping price. I tell everybody, this is your body. This is important. You obviously care, and you need to do the proper research, find the proper clinician, the proper physician, or whoever is going to do that procedure, and you need
Mhm.
to make sure that they're qualified to do the procedure you're looking for. And so, buyer beware, you got to really do your research. Talk to the patients. Make sure you can see before and after photos. Make sure you can have that one-on-one consultation with the
Mhm.
doctor. And if you feel comfortable and confident, then, go for it. But
You
there,
should be meeting the doctor the first day on the day of the surgery, right?
well, it depends on your procedure.
Oh
Depends,
my God.
yeah.
So
Yeah.
tell us, how long have you been practicing and what
So,
have you seen?
yeah.
What were some of the challenges you
Uh,
faced with people?
Okay, so I've been doing this since 1997, and I was just honored by a television show called The World's Greatest Television Show. And what they do is they choose the best companies in their industry, and they have a whole selection process. And they chose me as the world's greatest hair transplant surgeon.
Wow,
So yeah,
congratulations.
thank you so much. And that aired nationally on Bloomberg. And so I've been doing a lot of media, and I actually find I really enjoyed it. But one of the things I'm always talking about is medical tourism because it's such a big deal right now.
Yeah.
And one of the things with hair transplants is the procedure they're doing in Turkey and overseas is a procedure called the follicular unit extraction.
Mm.
And what that is it's a way of how they're harvesting the donor in the back of the hair. So where when I will do a procedure, I do what's called the strip method, where I'm taking a piece of tissue out of the back, where
Hmm.
we open the patient up and we can see the follicles. We're able to have a good idea as to the quality of the hair that we're getting and the amount of
Right.
hair we're getting. What they're doing there is they're using something, picture a hollowed out pencil with a blade, and they're punching out holes in the back of the head
Oh.
individually.
Hmm.
And what we've already learned from older procedures like the hair
Huh?
plugs is that can mess up the blood supply and that can mess up the nerve supply and that can cause more scar tissue and that has more unsafe hair that's outside of what we call the donor
Mm.
area.
Hmm.
So patients are they might take a hair that may fall out later, or they might take a hair that's not as viable. So, and then the quality of the grafts aren't as good. And then also the doctor's not doing that procedure. This is done by the technicians. So
Oh,
yes, you can look up your doctor, but who's poking in those holes? So
wow. You're
and
right.
that and what's crazy is that's what's happening in the United States as well. So the doctor down the street, for example, let's say he's a dermatologist, he's doing his dermatology clinic, he throws an FUE machine in the back room, has technicians fly in, and he's not even doing the procedure. And that's what
Wow.
we're seeing all throughout the United States. And so I always tell everyone you have to understand what type of procedure you're getting. It's very it's intricate. There's a lot of things that go into getting that great result as far as the quality of your donor hair, as far as how fine your hair is, whether you have good density, whether you have good coarseness to the hair. All of those ingredients are what make the difference of a good hair transplant and a bad hair transplant.
Right.
And how,
Right.
and then the staff that's doing it, are they qualified? Are they qualified to cut the grass properly and maintain that they stay safe during the time that they're outside of the body until
Right.
they go back in? So it's a lot more detail than the patients understand. And they look at that best case scenario and say, oh, I'm going to go do that because I could save some money. And you just got to be a little bit more careful with how
Yeah,
you
and
decide for sure.
I think people have to stop using social media as their referrals, their medical referrals,
Yes,
because
yeah,
you can't verify
that's true.
the
Yes,
people and the content that's put on there,
yeah,
because I'm not going to put my worst case scenario in any situation,
sure.
especially if I'm claiming that this is my business.
Right.
So taking medical advice from influencers, no disrespect to any influencer,
Yes.
I think that has to be taken into consideration. And medical health surgery is life-threatening. I don't care what you're doing, you know.
You're everything you're saying is correct. Yeah, you could get one of these weird infections. You could,
Yeah,
they might hit a vessel that they don't know how to properly control. They
right.
might connect an artery and a vein together.
Oof,
There's all sorts of little things that can happen that you got to be aware of. And what are what can you do in the event that that happens? What are your repercussions for that?
right. And
Yeah.
now we're in the wedding industry, so it's the most time that everybody gets vain. All of a sudden, I
Yeah.
need to look like Brad Pitt, Denzel
Yes.
Washington, Halle Berry.
Of course.
It's like, no, let's deal with us on a from a lifestyle basis. And so this medical procedure, even though it's hair transplant that you do,
Yeah.
what is usually the process? It must vary with every person. So it's not like
Yeah.
overnight and then
Yeah, again, 100% right. Yeah. So what we always want to do is always want to step one, make sure we understand why the patient's losing their hair,
Mm-hmm.
because we want to make sure we stop future hair loss. The
Mm.
great thing with men is that's pretty straightforward. 99.9% of the time, they have what's called genetic male pattern hair loss.
Mm-hmm.
And thankfully, we have two FDA approved treatments that
Mm-hmm.
prevent future hair loss and work. So we want to get them
Fantastic.
established on what's called finasteride and minoxidil to help maintain what they have. Once we get that situated, then the question is what are they trying to do? Are we trying to restore the crown in the back? Are we trying to lower the hairline? Are we trying
Right.
just to thicken it up all over? So
Mm-hmm.
depending on what the patient's needs are as far as the stage of their hair loss, will determine how extensive a procedure it is. Some patients might get away with doing smaller cases if they might only have a little frontal hair loss or smaller crown work. Other patients, I'm sure you've seen these patients that just have that little ring of hair around the back.
Yeah.
They're going to need a lot more work. So
Yeah.
it's just,
Yeah.
it's patient dependent for sure.
And now, do you do both men and women?
Yes, I'm glad you asked that because so women is a completely different animal because they can be losing their hair for so many other reasons.
Right.
They can have male pattern hair loss, which, believe it or not, is the best case scenario for a female who's losing their hair. But
Right.
then they can have a lot more serious systemic things, whether it's a collagen vascular disorder,
Okay.
hormone deficiencies, pituitaries, thyroids. There's so many different systemic illnesses that can cause hair loss. And so the same thing, we would need to figure out why they're losing their hair, first of
Mhm.
all, get that stabilized before you'd even want to consider moving forward with a procedure. Because we don't want to waste your money and your time, and
Right.
we put all this hair up there and then you just keep losing the hair.
Right. Right.
So we want to make sure we have you stabilized before we move forward with the hair transplant.
Now, this is more a personal question for you. Why did you pick this industry to get into your
That's a
career?
great question. It's a great question. So my dad's a doctor, and since I was a little, he's my idol. He still is,
Oh, I love
and
that.
he's an obstetrician gynecologist, and so I
Hmm.
knew exactly what I didn't want to do. No he, he was getting, he's a hardcore, surgeon, doing delivering 15, 25 babies a month by himself
Woo!
and getting called out of dinner and not, worried
Right.
about the movies. Anyways, I wanted more of a life. And so
Hmm.
I was thinking originally that I wanted to do orthopedic surgery. That was
Mm.
my thought process.
Hmm.
So I grew up in Michigan, and so I always hated the cold and wanted to get out. And then I went to medical school. I went from Michigan State to medical school in Iowa, and I wanted to get to Florida. And so once I got to Florida, managed care had taken over. And this is when they were telling the patients, or the doctors, who they could or could not admit to a hospital, what medications they could
Mm.
or could not prescribe. They were really controlling medicine. It was a shift in medicine that was happening back in the mid 90s.
Hmm.
And I didn't want to be told how to manage my medical practice and what I can and cannot prescribe or who, I wanted to be my own boss. That's what I always thought medicine
Yeah.
was about. So in discussing it with my dad, he's like, you need to figure out something in cosmetics so you don't have to be controlled by the insurance companies.
Right.
And my friend who was in the same boat was in radiology, going through the same thing. And he got started working with the company as a hired gun doing the hair transplants traveling across the country. And it was a new company. And he's like, hey, this is a great procedure. The patients absolutely love it. They're
Oh,
hiring. Is this something you might be interested in?
right.
I said, okay. So the owner of the company flew out and we met, we hit it off. And I was in my internship and he hired me.
Oh,
So I
that's
came,
fantastic.
yeah, so I came
That means you're
straight.
good at what you do, huh?
It's all I've ever done. I came straight out of my internship in 1996, started in 1997, and this is all I've ever done since. And
That's
I love it. I still get
fantastic.
excited to do it every day. Yeah.
That makes a
Yeah.
huge difference.
Yeah.
Now you touched on something which will be my last question for you is this something that's covered by insurance or this is all out of pocket for the patient?
The quick answer is it's a cash. In general, you pay cash.
Okay.
However, there are rare circumstances where patients do have real medical reasons that they need it, and then
Okay.
they're able to process that through their insurance. But
Okay.
mostly it's pay as you
Yeah, you
go.
pay. Yeah, I totally. And that's why I want to make clear. So
Yeah.
thank you so much.
Thank
I've learned a
you.
lot from
Uh,
it. I'm going to get some more information so I can share with our readers,
yeah.
because for some people it's not about vanity. It's about,
Yeah.
they feel better,
100%.
and so some people like, shave it all off and I'll be fine. Who cares? They
Right.
don't care about balding. Whereas
Yeah.
other people, they're not ready for that part of
Yeah.
it. So I think this is a great option for you, for
Definitely.
people, that can come and see you. So now, how do people get consultation? What's your website? What's an email or phone number that they can contact and get a consultation to book an appointment and fly to sunny Florida to see you?
Thank you. And I just want to say one thing on to what you said because I agree. It sounds corny, but hair transplants definitely can be life-changing because it
Oh,
changes how you see yourself. It gives you that confidence back and it makes you feel better about yourself. And
absolutely.
that changes the whole world around you. So you're
Absolutely. I
100%
agree with
right.
you. No, I
You're
agree with you.
100% right.
As a black woman,
Yeah.
if I'm not ready to let my hair go, I don't
Yeah.
care what you're saying, I'm not letting my hair go. So anyone else,
Yeah,
I can't even tell you the
exactly.
hair is, especially it's like if it's falling out of too early, too premature, it
Yeah.
does something to you psychologically,
100
mentally.
I have my patient today. He's been coming into my office since he was 16, and every year I said, let's wait, get him on meds, let's hold off, trying to just see if I could.
That's awesome.
And then so he finally came in 4 years later for the surgery today.
Okay.
So it's interesting. But I do my best to keep them. If I can
Yeah.
save you, I want to save you from
Mhm.
having the procedure. So I always want to do step one, the treatment, see if we can get you stabilized, see if that gets you to where you want to be. And then if we have to do the surgery, that's always an option. So anyway,
That's
so
awesome.
Dr. Brett Bolton, it's a great hairtransplants.com. That's the website. Office telephone number 954
Thank
Thank
you.
thank
Do you
you.
have
Thank you.
Instagram or social media or
Yeah,
anything?
we're on Dr. Brett Bolton on Instagram. We're on all the social media stuff. So
Fantastic. It was a pleasure
it's
chatting
such
with
a
you.
pleasure. Thank you so
Thank
much for
you.
having me. Anytime. I
Yeah,
enjoyed
thank you for being transparent because that's
it.
really important. When we talk about people's health and life, for me, that's really sensitive.
I
It's not about
agree completely.
vanity.
We agree.
And we love all the plaques behind you, so we know you're worth it.
They're all fake.
I love you already.
Thank you so much. I appreciate it.
No problem. Well,
All right.
guys, there you have it. Dr. Bolton, please stay tuned as I continue and I'll write the piece about him, give you some more information. Go to sunny Florida, get your consultation, and see if this is a right fit for you. So until the next time, ciao, Bella.